In a related story, Director of Pharmaceutical Services at the Osun State Hospital's Management Board, Dr. Motahat Olulawal, has called for an urgent expansion of consultant pharmacist clinical roles in Nigeria, describing it as a critical step towards improving patient care, reducing medication errors, and strengthening the country's healthcare system. Delivering the keynote address at the 8th Scientific Conference and Annual General Meeting of the West African Postgraduate College of Pharmacists Nigeria chapter in Lagos, Dr. Olulawal said consultant pharmacists must move beyond traditional dispensing roles to become integral members of multidisciplinary healthcare teams. Here's the report.
According to reports, more than half of adverse drug events are preventable through pharmacist-led interventions, while 1 in every 20 patients worldwide suffers preventable medication-related harm. Speaking on the conference theme, Expanding Consultant Pharmacists' Clinical Roles in Nigeria to Optimize Patient Care and Medication Safety, Dr. Olulawal described expanding consultant pharmacists' responsibilities as a healthcare survival imperative rather than a luxury.
We are looking at expanding the scope of our practice beyond traditional roles, collaborative prescribing, and all that. So, this is what I said earlier. Why does it matter now? Why are we bringing in consultant pharmacists now? 1 in 20 patients is harmed by preventable medication-related events worldwide. We have at least 50% of adverse drug events that could have been prevented through pharmacist-led intervention.
To strengthen consultant pharmacy practice nationwide, Dr. Olulawal advocated strategic recruitment of modern pharmacists into hospital practice, expansion of residency and specialist training programs, and increased adoption of digital technologies to support clinical decision-making.
And Nigeria afford the cost of preventive medication error, and we afford it. We cannot. Then we advocate for dedicated budget lines. We need this amount for this. Be specific.
Chairman of the occasion stressed that pharmacists possesses the expertise to improve medication safety, urging policymakers and healthcare institutions to create an enabling environment for consultant pharmacists to contribute fully to patient care.
The initiative of this conference will contribute not necessarily to the pharmacist sector, it's contributing to healthcare sector because the work of the pharmacist is not reserved for the pharmacist alone or their sector alone. The pharmacist's role impacts on the totality of the healthcare outcome.
Also speaking, Chairman of the West African Postgraduate College of Pharmacists, Nigeria chapter, Dr. Afuset Adeshina, said the conference was convened to equip consultant pharmacists with the knowledge, skills, and strategies required to meet emerging healthcare challenges.
The federal government of health have implemented the consultancy KIDA. The implementation has been approved, but some states up till now have not carried out that implementation. So we are calling on those states, those federal health institutions that have not carried that out, to kindly implement the consultant pharmacist KIDA.
Other experts also charge individual pharmacists to continually build their clinical competence, pursue advanced qualifications, mentor younger professionals, and establish specialist areas of expertise.
That consultant pharmacists have garnered by virtue of having gone through a rigorous curriculum of the West African Postgraduate College of Pharmacists will bring to bear improved patient outcomes, not just in Lagos State, but the entire nation. So for us, it is a topic that is well deserved in the here and now, because we are assured and we believe that other states will follow suit by the federal government that has ensured that the consultant pharmacists have their own cadre in the scheme of service.
We believe that drug abuse is a growing problem all over the world, and we need to tackle it scientifically by raising awareness and to also prevent it, because prevention is better than cure. The more we therefore raise awareness and set up a mini subject around it to be able to teach people right from primary school to secondary school. Because
for you to have your own medication with a prescription, I would want to advise Nigerians to access only registered pharmacies or to obtain their medications in a hospital pharmacy. That is the only way to avoid the scourge of drug abuse and misuse.
As Nigeria's healthcare system continues to grapple with rising medication-related challenges, stakeholders at the conference said empowering consultant pharmacists with expanded clinical responsibilities will be critical to improving patient safety, medication management, and overall healthcare outcomes.